Welcome to G Fun Facts Online. Adolescence is a universal journey of change, growth, and figuring out who you are. But imagine if, during this already turbulent time, your body began changing in ways that felt fundamentally wrong, creating a deep and painful disconnect between your physical self and your internal sense of identity. For many transgender and gender-diverse youth, this isn't a hypothetical. The onset of puberty can trigger or intensify a condition called gender dysphoria, a clinically significant distress that has serious, well-documented impacts on mental health. Today, we're diving deep into the science of a medical intervention that has become a crucial part of supporting these young people: puberty blockers. We're going to unpack what they are, the elegant science of how they press a temporary pause button on development, and why the world's leading medical organizations consider them a safe, reversible, and often life-saving tool. This isn't about politics or opinion. It's about understanding the established medical science behind gender-affirming care. To start, it's important to place puberty blockers in their proper context, which is the model of gender-affirming care. This is a supportive, holistic approach to health care, endorsed by virtually every major medical and mental health organization you can name: the American Academy of Pediatrics, the American Medical Association, the Endocrine Society, and the World Professional Association for Transgender Health, or WPATH. The core principle is to support and affirm an individual's gender identity to help them align their life, emotionally, socially, and biologically, with who they know themselves to be. For young people, this care exists on a spectrum. It often starts with social transitioning, which means using a chosen name and pronouns, or adopting a hairstyle and clothing that feel authentic. For many adolescents, the first medical step in this journey, if and when it's needed, is the use of puberty blockers. It's a patient-centered approach, tailored to each individual's unique needs and circumstances, and it's grounded in decades of evidence. So to understand how to pause puberty, we first need to take a detailed look at the biological symphony that is puberty itself. It's a breathtakingly complex cascade of hormones, all orchestrated by the brain. It all starts in a small, almond-sized region of the brain, called the hypothalamus, which acts as the body's master clock. At the start of adolescence, the hypothalamus begins to release a hormone called gonadotropin-releasing hormone, or GnRH, in a very specific, rhythmic, pulsatile manner. Think of it as a carefully timed signal being sent out every 90 minutes or so. This GnRH signal is a message, and it travels to the nearby pituitary gland, which you can think of as the body's central relay station. When the pituitary gland receives these pulses of GnRH, it is stimulated to release two other crucial hormones into the bloodstream: luteinizing hormone, known as LH, and follicle-stimulating hormone, or FSH. LH and FSH then act as long-distance messengers, traveling through the bloodstream down to the gonads, the testes in individuals assigned male at birth, and the ovaries in those assigned female at birth. This signal from LH and FSH is the final instruction. It tells the gonads to dramatically ramp up the production of the primary sex hormones, testosterone in the testes and estrogen in the ovaries. It's this flood of testosterone and estrogen that drives the development of what we call secondary sex characteristics, the physical changes that doctors track using the 5-stage scale known as the Tanner stages. In individuals assigned female at birth, rising estrogen levels cause the LARC, which is the beginning of breast development. It also leads to a widening of the hips, a redistribution of body fat, and eventually menarche, the onset of menstruation. In individuals assigned male at birth, rising testosterone causes the testes and penis to enlarge. It triggers a significant growth of the larynx, or voice box, which includes the development of the laryngeal prominence, or Adam's apple, causing the voice to permanently deepen. It also stimulates the growth of facial and body hair, and an increase in muscle mass and the broadening of the shoulders. For cisgender youth, whose gender identity aligns with their birth sex, this is a natural rite of passage. But for a transgender youth, this process can feel like a nightmare. Watching their body develop features that directly contradict their identity is a source of intense distress. And crucially, many of these changes are irreversible without major surgical interventions later in life. A voice that has deepened cannot be undeepened. Breast tissue that has grown will not go away without a mastectomy. This is why the prospect of hitting a pause button is so medically important. So how exactly do you pause a process that intricate? The solution is both elegant and rooted in well-established medical science. It involves a class of medications called gonadotropin-releasing hormone agonists, or GnRH agonists. Now that name is a mouthful, but the way they work is incredibly clever. And it's important to stress this is not new or experimental technology. The science behind it won a Nobel Prize, and these exact same medications have been safely and effectively used since the 1980s to treat precocious puberty, a condition where puberty begins at an unusually young age. Their application in gender-affirming care, which began in the Netherlands in the 1990s, is simply a well-established, off-label use of this trusted medical tool. Here's the science. A GnRH agonist is a synthetic molecule designed to mimic the body's natural GnRH. When it's administered as a continuous, steady dose, usually via an injection every 1 to 3 months, or a tiny matchstick-sized implant under the skin of the arm that lasts for a year, it binds to the GnRH receptors on the pituitary gland. Remember how natural GnRH works in rhythmic pulses? The GnRH agonist does the opposite. It provides a constant, unceasing signal. To explain this, the best analogy is a doorbell. In normal puberty, the hypothalamus is pressing the doorbell in short, rhythmic bursts, and the pituitary gland inside the house answers every time by releasing LH and FSH. A puberty blocker is like someone pressing the doorbell and holding it down continuously. At first, the bell rings loudly, a brief initial flare-up, but after a very short time, the system overloads. The person inside gets so annoyed by the constant ringing that they just go to the breaker box and cut the power to the doorbell. This is called down-regulation or desensitization. The pituitary gland's receptors effectively shut down from the constant stimulation. By desensitizing the pituitary gland, the puberty blocker completely stops the release of LH and FSH. Without those signals, the gonads never get the message to produce testosterone and estrogen. And just like that, the entire hormonal cascade is paused, and the progression of puberty halts. The key takeaway is this: puberty blockers do not introduce any new hormones into the body. They simply and temporarily suppress the body's own production of its endogenous sex hormones. This leads to the most critical feature of this intervention: its reversibility. If the medication is stopped, the continuous signal disappears. The pituitary gland's receptors wake up and become sensitive again. The hypothalamus' natural pulses are received, and the entire process of puberty simply resumes right where it left off. Studies confirm the return of hormonal and gonadal function after treatment stops. It's like pausing a movie. The action on screen stops, but nothing in the film is erased or permanently altered. When you press play again, it continues from that exact point. This reversibility is the cornerstone of their ethical and medical use in gender-affirming care. But why is this pause so beneficial? It's about so much more than just preventing unwanted physical changes. For a young person in the grips of gender dysphoria, a recognized medical condition with devastating consequences if left untreated, this intervention can be a literal lifeline. The positive impact on mental health is profound and extensively documented in medical literature. Numerous studies have established a powerful direct correlation between access to puberty blockers and dramatically improved mental health outcomes for transgender adolescents. This treatment is consistently shown to cause significant decreases in the symptoms of depression and anxiety. But the most critical finding relates to suicide risk. The statistics are stark and, frankly, staggering. A landmark 2022 study published in JAMA Network Open found that for transgender and non-binary youth, having access to gender-affirming care like puberty blockers was associated with 60% lower odds of moderate to severe depression and 73% lower odds of suicidality. A 73% reduction in the odds of suicidality is not just an abstract number. It represents thousands of young lives potentially saved, thousands of families spared from unimaginable tragedy. By preventing the development of physical traits that cause intense distress, blockers allow a young person to feel more comfortable and at home in their own skin. This improves body satisfaction, which in turn improves their social functioning and overall quality of life. Suddenly, they can focus in school, participate in gym class, or go swimming with friends without crippling anxiety. The pause also creates the invaluable gift of time. It gives the young person, their family, and their healthcare team a crucial period to explore gender identity without the ticking clock of irreversible physical changes. It allows the adolescent to experience life in their affirmed gender, to see what feels right, and to make calm, thoughtful, and informed decisions about any future medical steps. This period can also reduce the need for more complex and costly surgeries later. For example, by preventing breast growth in a transmasculine youth, the need for top surgery may be avoided. By preventing the jaw from squaring or the Adam's apple from growing in a transfeminine youth, the need for complex facial feminization surgeries can be significantly lessened. Given the life-altering importance of this treatment, it's no surprise that the decision to start puberty blockers is made with incredible care and diligence. This is not a hasty decision made in one appointment. Leading international guidelines, like those from WPATH, outline a clear, comprehensive, and multidisciplinary assessment process. The criteria generally require a young person to have a long-standing, intense, and persistent experience of gender dysphoria. This distress must be shown to be worsening with the onset of puberty. A thorough assessment also addresses any coexisting psychological, medical, or social issues to ensure the adolescent is stable and supported. Crucially, the adolescent must have the cognitive and emotional maturity to give informed consent, meaning they understand the treatment, its benefits, its risks, and its reversible nature. And for minors, the consent and support of parents or guardians is essential for a positive outcome. The assessment is a collaborative process involving a team of experts, often including mental health professionals, pediatric endocrinologists, and primary care providers. And just to be crystal clear, these medications are only prescribed after a young person has naturally entered puberty, typically at Tanner stage 2 or beyond. They are not used on prepubertal children. Now, like any medical intervention, puberty blockers have potential side effects and long-term considerations that are carefully weighed against their immense benefits. The two that are most discussed are bone density and fertility. Puberty is the single most critical time for building bone mass, a process that relies heavily on sex hormones like estrogen and testosterone. Because blockers pause the production of these hormones, they can cause a temporary slowing of bone density development. Studies show that while on blockers, an adolescent's bone density may lag behind that of their peers. However, this is an expected and actively managed effect. Doctors monitor bone health with periodic bone density scans and often recommend calcium and vitamin D supplements. Most importantly, research indicates that this effect is largely reversible. Bone density typically catches up once a person either stops the blockers and goes through their body's innate puberty, or, more commonly, begins gender-affirming hormone therapy with estrogen or testosterone, which then effectively promotes bone mineralization. The second consideration, fertility, is more nuanced. It is critical to understand that puberty blockers by themselves are not considered to cause infertility. If a person stops taking them, their reproductive capacity is expected to return as puberty resumes. The question becomes more complex when puberty blockers are followed directly by gender-affirming hormones. If an individual begins blockers at a very early stage of puberty, their gonads will not have matured to the point of producing viable eggs or sperm. If they then proceed directly to taking hormones like testosterone or estrogen, without ever going through their body's endogenous puberty, they may not develop the ability to produce those gametes, which could result in infertility. For this very reason, a thorough discussion about future fertility and options for preservation is a mandatory part of the counseling process before treatment ever begins. This involves weighing the definite and immediate risks of untreated gender dysphoria, depression, anxiety, suicidality, against the potential future desire for biological children. So let's bring it all together. The use of puberty blockers in gender-affirming care is not new, and it is not experimental. It is an evidence-based medical practice supported by a global consensus of major medical organizations and backed by decades of clinical experience. The medications themselves have a 40-year track record of safety from their use in treating precocious puberty. For countless transgender adolescents, these medications are nothing short of a lifeline. They provide a safe, reversible pause from the profound distress of an incongruent puberty, which in turn dramatically improves mental health and demonstrably reduces the risk of suicide. By understanding the robust science, the elegant hormonal symphony of puberty, and the clever mechanism by which these medications safely press pause, we can see that puberty blockers are a compassionate, effective, and profoundly important medical tool. They empower transgender youth to navigate their adolescent years with authenticity, safety, and hope, giving them the chance to grow into the healthy, well-adjusted, and happy adults they deserve to be. Thank you for joining us on Fun Facts Online.